Hello, and thank you for joining us on Accenture's Industry Innovation Cast, with today's focus on the MedTech industry. I'm your host, Jim Cleffy, and I'm excited to be joined by Martha Cotton, who's an anthropologist by training, ethnographer and designer by trade, and the global lead of Accenture's Fjord design team. We also have joining us Tim Durst, who's an industry expert and advisor, a business strategist and the global lead of Accenture's MedTech industry. Today, we're going to address 4 pressing questions the MedTech industry faces as it looks ahead to its growth, delivering product service design, business value, and ultimately improve patient outcomes. We're going to draw inspiration and insight from Accenture's Fjord 2021 Trends research. We're also, throughout the session, going to bring 2 distinct perspectives. One is a human experiential design perspective from Martha, and the second is a deep MedTech and business value perspective from Tim. Both are complementary views, both critically important for industry innovation, and both essential for industry growth and success. So without any further ado, why don't we just jump right into this? And I'm going to start with you, Martha. From your experience in both the research that you've conducted and the 7 trends that you helped to design with Fjord, where and how is care delivered to patients going forward for the MedTech industry?
The literal place that people have gone to address their health questions, their health concerns, has changed, and there's been a huge shuffle for as people really shift how they get the health support and care that they need. As we talk about in do-it-yourself innovation, people have been very innovative in order to get the healthcare support that they need. And I think we've seen, a rise in telemedicine and other ways that people have really shifted that place of healthcare to the home and have actually been really adaptive in making that work for them. I think there's an opportunity to be really inspired by the things that people have done there as they've adapted to healthcare at home. And I think there's an opportunity for MedTech companies to really understand how they can be part of this behavior change, support people as they explore and grow their comfort, within the comfort of home as they manage their health. And then also, as I think there's an opportunity as we explore in the rituals lost and found trend, there's an opportunity for MedTech companies to be part of the new rituals around health and wellness that people have established for themselves.
Yeah, and those are great points. I think there are a ton of learnings from that, and it's pretty amazing what human ingenuity can accomplish in some challenging times. But Tim, let me pivot over to you, because over the last 12 plus months, the very examples that Martha had mentioned have somewhat flipped the MedTech industry on its head. And I'm just curious from your vantage point, what you're seeing as an advisor, how are these trends challenging us to rethink how we're advising our clients and what the clients need to be doing to deliver patient care differently to patients going forward?
COVID in the last year has accelerated a number of trends that have been occurring for a while, and this shifting care environment and overall care models, covering the entire patient pathway experience versus putting in a point product has been a theme to improve outcomes, improve quality of care, and overall improve patient experience and provider experience. It's been a necessity within the ecosystem for a while. What COVID has done in the last year has really brought to the forefront the opportunity and validated things like home care, telemedicine, how we can leverage different avenues like retail centers to provide care where we might have had to do it in a pure clinical setting before. If you look at things that our companies and clients are working on in broadening the experience, moving from point products to broader patient engagement solutions, software as a medical device, artificial intelligence, connected medical devices, we have a wealth of new avenues of helping a patient and creating a new experience. And again, patients, I also mentioned, are driving this trend. Patients, at the end of the day, not just out of necessity of COVID, but they're having experiences in other environments like the retail setting, the e-commerce settings, where they're expecting similar activity out of the healthcare system that hasn't really come along as fast on some of these dimensions. They're taking control of their own destiny in many, much more broader sense. And again, that is driving I think a change that's going to be very dramatic, in the next several years.
Given the working environments that have been so dynamic recently, what does the MedTech industry need to do differently to attract and empower this talent help, build these types of products and services you just mentioned?
It's one thing to create a vision of where you want to go, but you're creating it in an area for which you've had less experience and comfort. Connected devices, software, artificial intelligence. Moving from a product model to a service model in many of the companies is not inherently in the DNA of the operations of many of the MedTech firms. Part of that, the biggest part of that DNA, besides business process, et cetera, you need a broad vision, but you also need the talent that are going to support. And you just brought up a number of key areas. When you think on the technology side of some of the areas that we've talked about, you're in competition with high tech. You've got to compete now with the same people that Apple, Google, Microsoft, frankly, startups. Those guys are also the mature high tech. The new talent's wanting to go to the new startup organizations that are getting into the next generation of tech. How does MedTech compete in that world? And the reality is there's a number of things that can be done. Number one is it's got to be a clear vision, and they've got to embrace the opportunity that this sector has. It is a step change for them to lead the charge into these new business models in these companies that really hasn't been the mainstay core competency in the past. It's an awesome opportunity for them individually. We'll also talk about, what healthcare is. There's a lot of people that come into healthcare for many altruistic reasons. We have our own care. We've seen relatives that could be doing better. I mean, what better place than to create an environment where I can create novel new technology, evolve an ecosystem, transition an entire industry, and also help people along the way. We really need to kind of continue to sell that story as the industry to make sure that we get the right talent.
Yeah, that's a great point. And I think that, healthcare over the years, it's a great reason to wake up and go to work every day. I think we have to evolve the story, to your point, a little bit more. But Martha, on a similar topic on talent, let's take a different lens or an angle to this one here. We're all experiencing right now a different work environment. I know the three of us have worked together. We're from different locations. Typically we get together. We haven't been in a long time. But there's it's definitely challenging the culture, the ethos of the work environment, and possibly even the DNA of people as we start to look at the future workforce of some of our industry and of our businesses.
Yeah, it's so interesting. I feel like I have a discussion every day now with a client or a colleague about what's going to happen in the future of work. And it's a really interesting space right now. I think there's a lot of experimentation, a lot of prototyping going on right now. Tim mentioned the idea of these hybrid work experiences, and I think that's what we're going to see more and more of. We need to be flexible, create environments where people can leverage the best of what we learned about the benefits of working in a remote context, and also recognize that face-to-face matters, and it's a premium. One of the things that I think we have learned about the human experience of work in remote context is the loss of what we call the periphery. So imagine a new employee in a MedTech organization. They're showing up remote. They're not meeting someone at the coffee machine and getting to know them and learning from some of the more senior people in their organization. These are the kinds of things that we have discovered really matter, things that we didn't even know we needed. I think this is especially true for younger generations, our more junior talent. They're digital natives used to being online, looking for very flexible and demanding flexible approaches, kind of this fluidity and seamlessness in their experience of a hybrid work experience. And I think the last thing is, supporting people to have flexible solutions that work for them, and then really importantly, injecting fun and serendipity into our work. These are the things that we definitely miss and need more of.
Throughout this discussion so far, both of you have really talked and hit on this notion of experience. And when I think of experience, it seems to be this really broad context, broad topic that means a lot of different things to a lot of different people in a lot of different contexts. I guess, with all the screen times that we have, with these ubiquitous user interfaces, et cetera, it all seems to blend together. And is it all just becoming one new distinctive experience, or how do we reimagine the personal and digital experience for MedTech going forward? Because the term's thrown out quite a bit. Martha, why don't we start with you?
Yeah, it's a great question and a great design challenge to infuse joy, serendipity, texture into our digital interactions. There's actually, interestingly, over the last few decades, there has been, there's been a phrase around called minimalist design, which has really been pushed by a lot of designers, kind of making things simpler, plainer. The response due to this dullness that we feel around the sameness of our interactions is to now push for maximalist design. Infuse these interactions with texture, with joy, with borrow from entertainment and gaming, where we can create these immersive experiences. And I think this is especially true in MedTech. Again, as we talked about, people increasingly becoming the agent of their own health journey and relying on digital tools to engage with their health service providers. So we have to kind of infuse some of this texture and joy into those interactions. I think people they're craving ways to feel connected. They're craving more personable services. So we want to kind of think about don't assume that just because an interaction is digital, we can't infuse it with that humanity and that texture and that immersion that we also crave from our in-person interactions.
When we think about healthcare or the medtech industry, in a similar topic or similar vein, people don't distinguish themselves as a consumer versus a patient. They're an individual, they're a person, right? They're a family member, a mother, a father, a veteran, etc. It's all the same to them. But yet our industry has struggled in the past to really treat the patient and not the whole person. What do we need to think differently about it as an industry to reimagine the personal and digital experience?
When I think of the engagement under the model I had talked about, moving from products to solutions, getting everywhere from the front of like helping to tell a consumer what their likelihood of disease is, let alone diagnosing the disease, treating, post-monitoring, tons of interactions throughout. And that could be done very, generically for a particular disease state, but ultimately the experience that people want is things that are personal to them, helping to navigate the different pieces of the healthcare system. How many different physicians, doctors, avenues do people need to go through? And it's got to be a common approach and experience that helps them along their journey, that they can feel they're being cared for on an individual level, not a number level passing through the system, let alone, a folder moving from doctor to doctor. Many companies in the medtech world, I would call high-tech oligopolies. The baseline technologies I can get from the top 3 people, put any one of the implants in my body, I'm probably generally okay. It's going to come around to how do I do that along with the overall experience and other services I get around it that make it most effective. That's what providers will choose, and that's what patients will choose.
When it comes to business specifically, culture, values, and brands are becoming very synonymous. You're buying not just one, you're buying all 3. You're buying because of values and cultures, or you're not buying because of culture and values and brand. And it's really changing the dynamics of how humans experience and consume products and services. Overall closing question for everyone here is, how do we balance doing good with doing well as a company and an industry?
I feel like with our Fjord Trends report, we've been charting this tension between purpose and profit for several years, and it really kind of came to a pretty big crescendo for 2021. Organizations have narratives that demonstrate the things that they say they stand for. And then I think what people are seeking now, people being the consumer, the patient mindset, is not only sort of the statement of what they stand for in terms of what they have empathy for, but the actions that then go along with that. For medtech companies, empathy across experiences is a must-have, and we've talked about the notion of kind of understanding patients as consumers, as whole people who have a context beyond sort of their own health journey. And I think kind of understanding and having empathy for people in that way is really important. It requires kind of really having a considered understanding of people's experiences and designing for that, understanding people in context, and making them feel seen, feel heard. And I think, and that's a very complicated, easy to say, very complicated to do, because it is about sort of understanding people beyond their profile as a person with, say, a chronic health condition.
Tim, let me close out with you on this. I mean, for our industry, we're, like you used the term altruistic earlier. I mean, we're in a different position compared to other industries, but will you share a little bit more on this topic for us?
Yeah, if you look at, as I mentioned before, the great thing about the MedTech industry is in many ways compared to other industries, it has not been looked at as always profit versus do good. I'm working with multiple of our MedTech clients and watching patients get up on stage that, could not walk before and all of a sudden can. You get that inherent sense, and it is built into the culture of our top MedTech firms across the world. I think COVID has highlighted how MedTech and pharma have all come together to address this scenario and address it in a very nonprofit oriented way. We need masks. We need ventilators. We'll give the ventilator design to people that don't even make ventilators to go and make ventilators. We'll get this new vaccine out the door, and we won't take the shortcuts, but we'll do some logical things that we think we can do to get the supply up and be able to release this and conduct a supply chain activity around it to basically get many people vaccinated very quickly. One thing I always love to emphasize to those that work in MedTech is remember what the end goal is. You can get lulled over as like any of the large companies into your role in a particular job, but everyone is contributing to one thing in many of the MedTech companies. It's helping specific patients in very specific disease states have a better quality of life, if not life itself. I think, how can you not just embrace that and keep reemphasizing that in the culture? And that attracts talent, and it should reinforce why we all get up, every day to help drive this industry.
For anyone listening or watching this, if you'd like to hear more or speak to our guests, that'll be made available to you. Again, thank you very much, Martha and Tim, and everyone out there. Take care. Thank you.